She will be talking about indirect effect of lengthy pandemic on ocular diseases, cases in which paradise was lost. I think this is another real trouble in this these days. I think uh, this is still continuing, no? Okay.
Good morning, everybody, and hearty welcome, respected chairpersons and my dear friends. Can you just start my slide video, please? Just stop it there. It is indeed a pleasure to be here. This is my first visit to Patna, and in the first MidCon conference of AIOC. So I'm really grateful to AIOC Scientific Committee for this chance. Now, the indirect effect of the pandemic and how we lost our paradise in two cases. I have no financial interest in anything that I'm going to talk. Loss in pandemic, why and how. COVID-19 pandemic had staggered eye care for 2 years. Slowly and steadily the cases emerged. All of us might have experienced, which did not report earlier, either due to the difficulty in coming and the diseases worsened and progressed. We report 2 such cases where gross vision loss was there either due to the disease or the treatment protocol or due to delayed reporting. It was a 63-year-old lady with bilateral pseudophakia which ended up with uveitis in right eye. The past history, she had bilaterally been operated in 2018 May with best corrected visual acuity of 6.6, N6 in both eyes. A phaco was done. She was a cancer survivor, but all her vitals were stable. She was not on any more treatment. Investigations and checkup by oncologists did not suggest anything. She had a tooth problem. The first episode were in December 2019. She reported blurring of vision in right eye as the main symptom on day 2 of the disease. Her intraocular pressure was normal, posterior segment was normal. She was treated with prednisolone acetate 6 times with tapering over 2 weeks, and she got normal. And she was followed up from December 2019. And we did not receive any phone calls from her. Now she came in April 2020 when she called up and said that she had similar blurring of vision in right eye as in 19 December. Due to restrictions of travel, she did not come. She was 80 kilometers away from Kolkata, so she was put on prednisolone acetate 6 times a day. She complained of sudden aggravation of toothache, which was scheduled to be removed. But then it did not happen due to the COVID-19 pandemic. On day 2, after consultation on phone, no video, she reported redness and pain, and it worsened, and she was given analgesics, etc. to manage. Finally, she turned on day 5. And this was the character of the eye that we saw immediately. Was anterior chamber was nearly flat. There was severe iridocyclitis with exudates in the iris. The pupil area was blocked with membranous exudates. CCC, prominent iris markings were obliterated. High pressure, 59 millimeter with occlusure pupillae with exudates. And she was in severe pain. So we had to do something. We gave oral acetazolamide tablets, IV mannitol, analgesics, anti-glaucoma, topical steroids. Half an hour, it was 56. So we had to do something. USG suggested nothing, like suprachoroidal effusion or hemorrhage. PI or a peripheral iridotomy could be done, but it was nearly flat. So we thought to find out one area where we could do a pupillotomy. And then after taking her consent, we tried to do a pupillotomy in the center because the periphery was nearly flat. So trying to save the eye with a contact lens, we used the first shot. Immediately there was a gush of fluid, and slowly the AC formed, and we used furthermost shots and enlarged it. The membrane retracted, there was relief of pain, tapering dose of steroids were started, and she went back. For 3 months she did well, but she lost to follow-up. Admitted with COVID in 2021, she developed post-COVID complications, diabetes. She reported only in August 2021 with recurrent episodes of pain in right eye. She said she used acetazolamide tablets, anti-glaucoma medications, steroids, and she was restricted indoors, morbidities, restriction in travel. Vision right eye then was only hand movement, IRP 58, and she had neovascularization of the iris. I'm not sure, but then can you just stop the video one sec? The sound is, can you just stop? It's not working here. Yeah. So I just wanted to show this picture. Please don't start the video, I stopped it. Yeah, so just this was the picture that this is the neovascularization of the iris that we noted, and because of the mismanaged episodes of uveitis and secondary glaucoma with ischemia, this led to nearly normal functional eye to become a severely damaged eye, and she also had inferior band keratopathy, maybe because of the consequence of mismanaged uveitis. So what to do next? It was beyond my control. I referred to a glaucoma specialist, a retina specialist. She received anti-VEGF, if you can see from here, and eccentrics. I have no financial interest in anything. And anti-retinal cryopexy was done because of this neovascularization of the iris. Of course, the neovessels regressed, but vision did not restore to 6/6. So paradise was lost in this case. This is this case 2. Again, a 63-year-old female, which had best corrected vision acuity of 618 when she reported it to us in February 2022, left eye counting fingers. Now, this patient also had undergone cataract surgery in November 2019 with 6/6 vision, and if you can see, the OCT and the fundus were absolutely normal in both eyes in 2019. This patient had COVID in April 2021, July 2021, hospitalized, bedridden. She could not come to us. 2 weeks to report. Her fasting blood sugar was normal when she came, and this was the picture in her right eye, a BRVO. 3 weeks of hospitalization, she received remdesivir, antibiotics, lots of them, anticoagulants, steroids, high flow oxygen, anything could have caused the bleeding, and OCT, which we repeated, had in one occasion showed 599 thickness of the macula on February 2022. We did the left eye to restore a bit of her vision, and she was given this she was advised anti-VEGF injection, but she could not take it because of her waxing and waning of the comorbidities post-COVID. She received it in May 2022. This is the picture. So all this, which had a normal OCT, ended up in something like this. After ranibizumab injection, we found there was a bit of CNVM. The edema had reduced. She is still under our treatment. Now, in this case also, what we presumed, the literature says that COVID-19 virus causes both anterior and posterior segment diseases. She was on anticoagulants, and remdesivir we know was given for life-saving, but it has some episodes of bleeding. And again, she had received lots of steroids, lots of antibiotics. So all this, and then she could not report to us at the correct time, which she said was from the start of her COVID, which might have all and ended up in this case of lost eye. Thank you for patient hearing.
It's a good presentation, madam.
Thank you, sir.
Actually, you have just represented 2 cases.
Pardon?
You have just represented 2 cases.
Yeah.
Really, there will be hundreds of
Hundreds
cases
of
like
cases,
this.
yes.
Mostly.
But, one thing I want to ask you, why you correlate with the COVID?
Yeah, because these people could not come to us because this case was saved. This patient was saved once with pupilotomy, the first case. If she had come to me earlier, then this NVI which had
I
developed
want
in
to
her
ask
eye.
you, in general population also you can get
Yes, sir, but that
this
prolonged
few number of
nature.
cases.
I am not relating to COVID disease itself. I am relating to the lack of communication that she had with us. Physical communication that she had, and she could not be treated also because of that. She could not reach us. It's not because of the disease. It's because of the prolonged nature of the pandemic that we are still, in fact, now patients can still travel. Actually, this patient was in Digha when she reported to me. So she did not get, she had to get a special permission from the DM to come to me. That took 3-4 days.
That means lack of treatment has
Because of the prolonged nature of the pandemic.
lost paradise, isn't it?
Yeah. Yes, sir. That is what I wanted to express.
I think this is mainly happened with the glaucoma patients,
Yes.
uveitis patients,
Yes.
and retinal patients, because it's not directly due to the COVID, because only few patients having COVID
Yeah,
problems.
that
what
was
to-
the theme, sir. I said
Yeah,
indirect
this is
effect
the
of
main
the COVID.
This is happened in so many cases. It's
Yes.
actually well-controlled cases lost because some of the patients even were not able to get some of the medicines because it was not
Correct,
available
correct.
to
It
their
was not
places,
available.
to their places because it was only opened few medical shops in the nearby. They could not travel it and they could not manage it. So it was a real trouble. You just showed a
Yeah, I
representation
just
of
tip of the iceberg. I just represented.
just showed how it is. Actually, even cataract is not that problematic, because some patients had a very mature cataract, and
Brown cataract.
some patients had even lens-induced glaucoma also.
Glaucoma, yes.
But other cases, like so many patients were lost glaucoma treatment and retinal treatment because
They could
diabetic
not continue,
retinopathy,
could not come to us.
diabetic
Diabetic retinopathy.
patients
And many of them,
lost.
so like this patient, the first patient, did not have glaucoma, did not have diabetes. So post-COVID, she developed diabetes. Due to that, her uveitis further increased and everything went haywire. So we could not restore the eye to what she actually had. That was the painful part of it.
What is the situation in Calcutta now? They are all coming.
Sir, regarding COVID,
Yeah.
COVID, we are having stray cases, of course, but none of them are that lethal.
No, I am asking in the other aspect. See, your old patients are all almost 100% coming back to treatment.
Yes, most
Yes,
of them.
that's good.
They have come back to treatment, and travel restrictions are not there. In fact, we've all given up on masks except for in the hospitals.
That is happening everywhere in India.
So people has actually tried to is trying to forget COVID.
No, sir, we have restarted using masks.
Yeah,
That's in the
we also
Fourth wave coming up, now we have restarted.
we also start.
We are expecting, ma'am, we are expecting after this Ganga Sagar that we are having, we are expecting a flood, but then that we are expecting as doctors. General people.
Cautious, because we are really jammed in, being in a government
Yeah.
hospital, we are jammed in by
Yeah.
patients, so we are now wearing our masks.
So one good advantage of this mask wearing is not only for the COVID.
Yes,
Actually,
coming to
then
diseases.
the other specialty people start telling. One of my friend was telling, say, we should stop using mask because I am not having any patient now. So these COVID years, actually all respiratory problem, regular patients having problems, they actually had a reduction in their diseases. So
Yes,
it has
very
gotten,
much.
we are discussing about our ophthalmic more problems and all. Some specialty having a reverse effect because of the COVID.
That's
So-
true, sir, because traveling with a mask gives you much, your throat is much better. So, pollution much
Pollution,
less. So,
So morning I was traveling with a mask because when I was going out, when you are using the mask, you will have a your
runny
lungs
nose
and all.
throat,
Because in Kerala, we are coming from Kerala, we are not that used to this
This
type
cold,
of climates. Climates actually.
climate.
So we don't have a temperature below 22 or something in any time in a year. So I think next year you all be coming to Cochin for the All India.
Dr. Mitra, just I
Yes,
want to
yes, sir.
mention one
Yes,
thing.
sir.
2 days back, I got a literature from America that new variants of COVID
Yeah.
is directly affecting the brain and the
Oh.
brain.
There are some reports like
Yes.
brain damages. It's not clarified yet,
Yes.
but it's a very, very
How is
dangerous
it?
one.
Yes,
think so?
recent variants of in the China or even in the America, it is directly affecting the brain and the
Optic nerve, they're affecting nerve
yes.
It's not confirmed reports, but they started the study.
study. Okay.
Some BXX5 or something.
And it is written that it is directly affecting the brain and the
It's a dangerous.
the eye.
No,
Somewhere
the
they'll
report
find
showing that it is affecting the brain.
Brain.
So following that, it comes to because optic nerve is directly to that
Yeah,
one. But no definite report. They have started studying the reports because only the initial stage of that one.
It is a very
We don't know.
dangerous scenario
If
then.
it comes to the India, then it will be real trouble. Thank you.
Thank you, sir.